This is Abnormal Psychology, Psychology 6506, and today I'm going to talk about the 4 Ds. Now these are 4 criteria that separate normal behavior from abnormal behavior. And if you look through the DSM-4R, you'll see that these 4 criteria have been incorporated into all of the diagnoses. So the 4 criteria we'll be looking at are deviance, dysfunction, distress, and danger. Let's start with deviance. Deviance is basically a statistical concept. You can measure particular characteristics if you're within the peak of the normal curve, if you're up here, or actually within this range, your behavior is fairly normal. So for instance, with intelligence, if you have an IQ between 85 and 115, you're essentially normal. The concept of deviance is if you're in the extremes, if you're in one of the tails. So as you remember from statistics, the 5% level of significance is what we use to consider something unusual. And this has been applied in abnormal psychology also. The extreme 2.5% at each end of this curve, down here, if you have an IQ that's in the bottom 2%, if other factors are present, you're diagnosed with mental retardation. If you're up here and have an IQ in the top 2%, you're diagnosed, or it's not really a diagnosis, but you're considered to have gifted intelligence. And other mental phenomena are also classified like that. If you're in the extreme, a lot of us have compulsive thoughts or we do things carefully, but at a certain extreme it becomes obsessive compulsive disorder. Now distress, if you run an outpatient psychotherapy practice and you see adults, this will be the criteria that most of your patients qualify for. Because if someone comes voluntarily to psychotherapy, they're probably coming because their symptoms distress them. So this is subjective and it's defined by the client. So depression, depressed clients generally experience distress. Manic or psychotic clients often don't experience distress, and they're less likely to come voluntarily to therapy. Dysfunction. This is another way to decide whether something is normal or abnormal. You may have, you may feel sad, but if you can still function in your day-to-day life, it's not pathological as it would be if you became dysfunctional. So some of the domains that people can become dysfunctional in are work and school, social and family, daily living, so your hygiene might decrease, you might not get dressed, you might miss meals, and recreation. And then the 4th criterion is danger. Sometimes clients are able to get their needs met, they're not subjectively distressed, but they cause problems for other people and are disruptive to society, or they're suicidal. So you've probably heard the phrase, danger to yourself or others. This is the criteria for involuntary hospitalization. So even if someone doesn't see themselves as needing treatment, society sees them as needing treatment when they meet this danger criteria. So that concludes this lecture.